Well, hands up everybody here who's made a will. Well, it should be everybody, no matter what age you are, all right? And then we ask people about making a power of attorney. It's really useful to do a power of attorney so somebody can handle your bank affairs and so on. If you can't sign a check and so on, you can begin it with that sort of practicality level. And then you can work your way around to medical power of attorney. And then that will enable you to get your way into talking about what kinds of interventions they might or might not be interested in later on as the disease progresses. You can't do it in one go. It takes time and patience and so on and so on. Now, some people just won't join in. There are some people who just won't talk, and I see some colleagues in the audience who will recognize the little story I'm about to tell you. One man whom I tried to engage in this discussion over a period of nearly 1 year said this to me. I made what was my last attempt. I said to this chap, now that your life is drawing to a close, and he just said, you need not go any further, doctor. In other words, he was not going to talk about it, and he never did. And we all know who I'm talking about. So you may just have to put up with that. Now, you need to record your decisions so that if the patient hasn't wanted to be intubated, they don't get intubated when they're taken to Box Hill instead of the Alfred or whatever it might be. And there's a federal and state drive on to use respecting patients' choices, type, documents, and so on. And you'll find these at most of the big hospitals. At Bethlehem, we tend to put the stuff in a more letter form and then send it to the patient. This is what we talked about. You don't want this, you don't want that, you would be interested in this, and let them keep a copy. And the copy goes to the GP, and we keep a copy in the notes. And if they've got a copy at home, it can be shown to the AMBOs when they arrive, if there's an emergency, or they can take it with them to ED. Now, the Victorian Respiratory Support Service, who work closely with us, they use the Austin Hospital Respecting Patient Choices documents. And there's a big drive on, as I've said, to have that introduced in all the hospitals around here. Palliative care doctors tend not to use those documents and direct their discussion around the goals of treatment. So they keep emphasizing the fact that they're treating you. We're still treating you, but the goal of treatment is different. The goal of treatment is not to try and make your cancer go away. It's to try and stop it from growing anymore in the place where it is, or whatever it might be. And you can use that kind of language if you want. Treatment goals. And these are just some useful references. The Ellershaw and Wilkinson reference is to the Liverpool Care Pathway, which was developed in Liverpool in the UK, not Liverpool, New South Wales. And most people find that very, very helpful in planning and recording and finding your way through these difficulties. So that's a short book by Oxford University Press. And the Jackson et al. I've completely forgotten what IMJ stands for, but it's the Journal of the Royal College of Physicians of Australia. They've just done a survey trying to introduce an adapted form of the Liverpool Care Pathway at Monash, which proved to be very successful in 4 acute medical wards, and now it's going to be rolled out to the whole of Southern Health. So the Liverpool Care Pathway is worth a look. And the other paper, ClinMed, Clinical Medicine, is the journal of the UK Royal College of Physicians. We're celebrating our 475th anniversary next year, just to let you know. They're looking for money already for the celebration. But that's a very interesting review article looking at what people said after a relative had died. So you'll see what it begins with. If only someone had told me about intubation, cardiopulmonary resuscitation, intensive care, etc., etc., etc. So those are 3 references that I think are particularly useful, and one of them is a true blue Victorian Melbourne production, only came out last month in the IMJ. So that's the end for me. Now, questions. Yes?
I think one of the things that's very important that you brought up is having, if you do have a document, having it with you. A lot of people say, oh look, mine's with my solicitor, mine's with my GP.
Yeah, that's right.
Try getting in touch with them on a Saturday night when the ambos are taking it away.
That's right, absolutely.
So you have
right.
a document where you know it is,
Yep.
where you can take it with you, because if you don't have it, you will have all that other stuff happen to
That's
you.
right. And we ask the patients who've got powers of attorney to bring us a copy so we can file it in the notes. So it's very good value to do that, quite right.
My question was just about how formal does documentation need to be? I guess some people are a little bit hesitant about drawing up official.
Yeah, well, I mean, powers of attorney documents and wills are very formal documents, and they have to be witnessed, and witnessed correctly. And the person who does the witnessing has to be sure that the person who did the signing was competent to do so, and so on and so on. There's a whole rigmarole around that. And people like Fiona and me often get sucked into discussions and arguments about how competent somebody is. When you're discussing treatment goals, however, these documents, which are collectively known as advanced care plans or advanced directives, have moral authority because all the institutions like the British Medical Association, the Australian Medical Association and so on, tell their doctors that they must respect them. So they have a moral authority. They don't have an overriding legal authority, however. But it's quite clear from case law that they do have legal authority. So if you do something that somebody has expressly said they don't want, they can, or the relatives can sue you. And a woman in Canada successfully sued the hospital who'd given her a blood transfusion when she said she didn't want it. And she got damages, even though they'd saved her life. She would have died without the blood transfusion, but she got damages. Now that's the Jehovah's Witnesses. We'll not take that discussion any further. The legality of an advanced care plan, however, is not absolute and complete. And if someone at the end of life has something, you know, they've said they don't want intensive care, they don't want some ventilation or whatever it is, and then all of a sudden they change their mind and say, but, you know, my granny's coming out from Belfast to see me and she'll be here in a week, can you just keep me jogging along till then? Well, you know, you'd be foolish not to try and help them if you could. But they definitely have a moral authority.